see if there is a couple of people. This is from workplace, okay. Just, how are you doing?
Just a routine.
I'm not well. I'm in severe
Okay.
pain.
Okay.
Routine.
What does that mean?
Meaning degree of disability, maximum medical improvement, it's all right there.
Oh, okay, this
Yeah.
is good. All right.
Yeah, so you got it there.
And my report,
Yep.
thanks for your help.
Oh, you bet. That's what I'm here for. They tell me that's why they pay me. Here's your report.
How many times did I see you,
It's Peter.
yeah, Peter Wrobleski? How many times did I see you, Mr. Wrobleski? Just the one time?
I think I saw you once.
Once?
Yeah, just once.
Okay. Thank you, Rich.
You bet.
Very much. And the phone, does that work?
Yes, it does.
Which line do I hit here?
Any of them. You got a dial tone?
Now I do, yeah. Which?
I just hit 3.
Oh, 3?
Yeah.
Oh, okay, so they're the lines. All right. Good. Thank you. Well, Peter, we're here to, basically here to make sure you're getting the treatment that you deserve. And are you?
No, I don't think I am.
Okay. Who's taking care of you primarily? Who's your treating physician?
Well, probably right at this point, you.
No. That's good. I'm glad that I asked these questions. I'm here to oversee the treatment that you're getting and your situation, and to comment upon whether you're improving with the treatment that you're getting at an endpoint, or that you are not receiving the kind of response to care that we want you to, so that you can get back on with your life and productive living. That's what I'm for.
Well,
I'm not here to treat or prescribe medication or anything like
I
that.
definitely am looking at that. That's what I want. I haven't driven a car since September 2012.
Uh-huh.
And, right now I'm in pain management, and I haven't found the right doctor yet that will operate and hopefully release some of what's causing the pain.
Why do you think you need surgery, Peter?
Because I got hurt in 2011, and the pain is constant, and it's not gotten better. So at this point, I don't see myself improving, without some type of surgery, and that's why.
Well, you did have surgery, didn't you?
Yes, I found the one surgeon in New Jersey who was willing to operate,
and he did.
He did, and
Did it help you?
no, the pain is still, the tightness in the muscles, and it didn't release the tension, which is what I was hoping it would do.
Okay.
And he kind of said, well, give it some time, but had the surgery January of this year. Now it's, October? I haven't felt any pain relief, so I would have liked to think if the surgery was successful, I would have felt some relief by now. But the positive thing is I'm no worse. So.
You say you're not worse.
Yeah, the surgery didn't make it worse because,
Oh.
one of the things they said is, you could lose
Well, they were giving you
paralysis.
advice and consent for the surgery.
Any surgery, they say, you might lose, you could be paralyzed.
Well, that's a responsible treating physician, especially if he's going to operate,
But-
has to tell you these things,
You know,
because you need to In other words, you need to know what you're getting, you know. It's
When
just-
you're walking into the OR and, you know, you're thinking about that, you know, that's pretty scary, but.
Of course it is, of course it is.
So, I've been trying to find, I wanted to go see it, you know, maybe I just didn't find the right doctor. I think that I'm looking for maybe a neurosurgeon that specializes in neck surgery. And I'm hoping for that.
Good. What kind of surgery do you think that, or did he discuss alternative procedures?
He didn't discuss anything else as far as referring me to anyone else other than, he said that, he has a pain clinic down in New Jersey that could do some type of injections. When I came back here, they said they didn't feel comfortable doing those kind of injections, so they said, so bottom line is, the treatment plan right now is, I get medication to try and control the pain, but it's just barely holding back the pain, and what do I want? I want a solution. I don't want to live. I mean, I can't work. I can't drive a car. I'm in so much pain. I had to put a shower seat in the shower because just standing in the shower hurts. And the soap, my hands, I tell the doctors there's tingling in both hands. That's from the first time I saw Dr. Wolf in 2011 till today. I still have the tingling, but yet, the last MRI I had of my neck, I think, was all I know is I asked pain management if they could order another MRI of my neck, a recent one. They said no. What am I going to do? I'm looking at, doctors at hospitals that specialize in neck surgeries, hoping that maybe one of them might look at me.
I understand.
So, I don't have an answer, but right now, I don't want to continue to just get, I took, at 8 a.m., I took a 40 controlled release Oxycontin and 2 15s and the Flexerol, and I am still in a lot of pain.
Where's your pain focused primarily?
It's both sides, left and right of my neck. The left side goes down here, right here. This is where the pain is. And right in here, it's almost like I've had massage therapists massage right here. Sore right in here. And on the right side, it's right in here. Oh, and all they tell me is they say the muscles are tight, like adhesions. So something is causing severe pain right and left of my neck in a wishbone. And it's been like that for years. It's the same pain. The only thing they can do is try and manage the pain, and that's the only solution that I have right now in Syracuse. What I want is
Pain go away.
I want another set of eyes. I would like a team of doctors who specialize in neck injuries, and from what I've seen down in New York City, there seems to be more doctors that do neck surgeries on a more routine basis. They see more cases. So what would I want? I would like to go maybe to like New York City Hospital and see a group of doctors that could at least evaluate everything and give me what they think. Give me options. Right now, I'm hoping for a solution. I don't know. I have, all I know is every day is the same. It's constant pain, and I just take the medicine to try and make it manageable. But there's no solution here in Syracuse. There's no one willing to say, okay, I'm going to go in there and try a surgery. I wish, I understand the risks, but I just want to, I want to be able to drive a car. I want to be able to do some kind of work. I want to be able to go to sleep at night. And I can't even fall asleep, even with the medicines. It's just usually from exhaustion. I'll maybe, and they're probably going to increase the medication or change something. At this point, I don't know. But I'm looking for I just hope that there's a doctor out there that says, I can help you. I know what's causing your pain, and I think this procedure will work. Unfortunately, the only doctors I see are pain management doctors now, and they're not surgeons.
Well, you saw a surgeon, you had the surgeon.
Yes, and
Isn't Dr. Elkwood, didn't he feel that he was a very capable...
He is, he's got great reviews, but,
You think there's somebody that may be better for you?
He's not God. He's a man. He went in there, he did his best. And I guess I should be grateful that I'm not worse. Sometimes people go into surgery and they're a lot worse. The same pain, it didn't help. So that's why I'm thinking, well, that didn't help. Then that information, if I pass it on to a neurosurgeon who does neck surgeries, maybe...
Well, what is Dr. Elkwood?
He is a plastic surgeon.
Uh-huh.
So...
Well, you know that operations on the brachial plexus, which is what we're oriented to, are most of the top-notch experts are, for some reason, are plastic surgeons throughout the country.
Last time we were here, I think you said the opposite. You said the opposite of that. You said...
Well, I thought you should be seeing a neurosurgeon, at least for some...
You said you never heard of a plastic surgeon doing this type of surgery. The last time I was here, you said that. Well, it doesn't matter.
That's sort of strange.
It doesn't matter. It's on the tape. But
Well, I'm looking through my books here, and I'm not coming up to anything that's more superior than what you had already.
Well,
But
I'm not gonna...
There's a hospital in New York called the Hospital for Special Surgery.
I know that.
And that's probably where you need to go.
Well, how can I get in?
Well, my recommendation here today ought to help.
Well, I hope that something like that will happen. That's what I want. Fortunately, it's very difficult to get in. No one takes comp. That's another problem apparently, because some of the top surgeons, they don't take comp. So it's like you got to get a waiver or some sort of special permission from the insurance company. It's possible. So maybe with your recommendation, I can get into New York, the Hospital for Special Surgery, and see their doctors, and maybe they wanted to run some tests. Maybe they have tools that we don't have here, and they can say, haha, let's try this. If it works, then I can get my life back, get some sense of independence back in my life, and that's what I want. That's what I want. Even if it's not 100% successful, if it's just 50% successful and I can reduce the pain medication, that's a success. To be able to sleep at night.
All right, let me ask you an important question here in our dialogue here. Have you ever had a neuropsychological evaluation? Or, in other words, putting everything in perspective as far as how you're reacting to your injury and so on. Very helpful to
Yes.
any doctor dealing with
Well,
pain.
have
you had one?
Yes, they sent me to I think you're talking about is it a psychologist?
Neuropsychological
They
evaluation.
sent me the one that was for the insurance company.
Well,
And then my pain management said that they want me to see another one, and they put in the request just, I think, a week ago. So
that's pending then.
that's pending.
Well, that's a good thing.
Yeah, it's pending. But right now I'm still waiting. They put it in, so I'm hoping. I'm just waiting, for the phone to ring, and then I can make an appointment.
We want to know that we're on the right track here as far as how you're coping and what this situation is doing.
All I can tell you is the muscles right here and right here are tight. They feel like they're torqued to the point that it hurts like hell. It's this burning pain.
Mhm.
And I take the muscle relaxer, it helps a little bit. But it's almost like someone is stretching the skin,
Mhm.
and it hurts. So someone says, well, if the muscles are that hard and that tight, it's got to be nerves. Well, I'm like, well, can I have a more recent MRI? No. Okay. Can I see doctors, in New York City? No. I don't know what else to do.
Well, I'm going to.
I'm trying, I'm reaching out
Try to help you.
to anyone who has any influence, and I'm trying.
Well, that's me.
Well,
That's me. We got to get you, and we have to satisfy your own needs and your own concerns about your physical.
feel right here. You tell me if this is normal. It's
Well-
constantly like this. Here,
Mhm.
feel that? It's like a rock.
That's your trapezius muscle.
Well, it's constantly tight on both sides, and the pain,
Well-
it never goes away. And then even in here,
Mhm.
when I stop taking the muscle relaxers, then it's like pulling here.
Well, to tell you the truth, this exam today, my being a neurosurgeon, this is outside of my expertise. I really don't know what to tell you.
Well, that's where it hurts. It's
Yeah.
like right here.
Yeah, I
Right
mean, I'm not a
here.
pain surgeon. I mean, we don't operate on pain. We operate on a diagnosis. And right now, I can't really make one, but I'm going to try to get one for you. Get a diagnosis for you. That's what we're talking about. Now, this is where he operated?
Yeah, the scar is. And
Did he operate over here?
he
at
didn't
all?
touch the right side.
The left side.
He just
And
did
it
the left side.
And it didn't help you.
No, and even back here, right here.
Mhm.
See that? Click. Hear that? Click. Ah!
Yeah, I don't know what to do with it.
He just says, he says it's like adhesions under the skin. And
From what?
Well-
You never had an injury that would scar that area, but
Ever since the guy hit me, you mean hard, in the class, with 16 people watching, I should have realized something when he hit the girl before me and she screamed, "Don't fucking touch me." I thought she was crazy. Well, after he hit me, I realized how hard it was.
what did he do? Was it a karate chop?
Karate chop. Well, he said, pretend to choke me. I was not choking him.
Crazy stuff, yeah.
I put my hands up in his, like this.
Mhm.
He did some move where he went underneath my
What was
elbows.
this, a karate class? I
Self-defense,
forget the-
mandatory self-defense training class.
Okay, I have to.
And then
read the chart.
he hit me here, and it hurt like hell, but I said, oh, it'll go away.
Mhm.
I went home, drank some beer. I figured, it's just sore muscles. To this day, it has never healed. And that's why you ask me what I want. I think seeing
Well, I know what
a
you
doctor
want, of course.
in New York City, Massachusetts General Hospital, some neurosurgeons who maybe they can feel around there, do a test maybe that
Look,
I don't
what's
know.
happened is you've lost confidence in the care around here. And
No
you
one
want-
will help
and
me
you
here.
want- And you wanted another facility to satisfy what we're dealing with.
If
Let me get a plain piece of paper here, I
it's
want
just,
to take some notes
it's
here.
2011 to today. I've tried physical therapy, chiropractors, injections. It's not getting better. I'm not jumping into surgery. It's been years of constant pain. If there was a pill I could take that I didn't have to have surgery, I'd take it. Jeez.
Just out of your printer.
Well, I must say,
All right, well, let me do a little exam on you and your range of motion. And I don't want to poke around much because anything I do is going to upset you. I mean, physically, put you in pain. I don't
I'm
want-
in pain
I don't want you,
constantly.
well, I don't want to worsen it, that's my
Yeah,
point.
you
Here-
know,
here,
unless you're
is
gonna
this scratch?
stretch me.
Do you feel this scratch?
yes, I can
Okay.
feel that
Feel this
scratch.
scratching here?
Yes, I can feel that.
Okay, how about under here?
Yes, I feel that.
All right, here and here.
Yes. Yes, I feel that.
Now, up in here, you have sensation here?
There's a sensation there.
Okay. Feel over here?
Yes.
Okay. Does it feel abnormal to you, like I'm worsening things, or is it just a pen being scratched?
Just like a pin being
Okay,
scratched.
so probably not really anything that's worsening you.
No.
All right. Now I want you to relax here. Good. Got good biceps reflex. Triceps is responding. Over here, one of the biceps is intact. Triceps. I'm talking to the camera here for your
Well,
purposes.
I don't know.
What's your
I-
name?
Mark.
Mark? Okay, Mark.
I keep asking doctors about the C3. Could it be possible?
C3 doesn't come down.
And they tell me that's impossible. C3
Well-
could not be causing this right here.
Well, I don't know about that,
Okay.
but it's not causing anything down here. That's important.
Why is it-
for us. Pull your hand in towards your chest for me.
Why is it that
Push
every...
out. Good. Pull in, push out. So the neuromuscular exam of your upper extremities is normal. Okay, push down here. Okay. Now, moving your arm up and down, does that cause pain in your?
Yeah, don't move it too much.
Okay.
It's just...
Have you seen orthopedic surgery?
I've seen orthopedic doctors. I saw Dr. Wolf, the first guy, and I said the tingling I feel in my fingers.
What does he think about your shoulders? You're having pain moving your shoulders, correct?
No, it's
Here.
it's here.
Well, but
This is-
am I provoking it
Yes,
by doing
yes,
this?
yes,
So I'm moving your shoulder now.
yes. But this is where the pain is. It's not on my shoulder.
Well, this whole thing is your shoulder. And I don't mean to
Whatever.
contradict you.
I can only tell you this is where the
But
pain
this
is.
is part, when we have a rotator cuff tear, for example, that will cause pain in this whole area. This whole area is affected. But that's out of my expertise. I'm not an orthopedic surgeon. So I can't tell you.
I've seen an orthopedic. They said they wouldn't operate on me.
Well, that's not everything they do.
Well, at least the ones I've seen up here.
All right, I want you to bend your head and neck forward for me until it's uncomfortable but not in pain, just to see what the range of motion is here. Okay, that is 22 degrees flexion. Understand why we do this is to see what you can do as far as your axial movements. 22 degrees flexion. Now I want you to look up at the stars. Okay, bend your head back for me. Is that all you can do without too much
That's it.
pain? Okay. That's 15 degrees extension. Okay. Now, want you to bend your head and everything to the right, a lateral bending. Okay, go ahead and do that as much as you can. Okay, that's enough. I don't want to torture you. We're not here to make things worse. Okay, that's 40 degrees. One more measurement, and we're done. Okay, I want you to bend to the left, just uncomfortable. I don't want you're in pain. Bend to the left. Is that your?
Yeah,
is that it?
that's it. It's very
All right,
tight.
that's enough. That's enough.
This shoulder comes up when I try and move my neck to the left. I don't know why.
It's 27. Well, it's because your muscles are in spasm.
I've taken Flexerol at 8 a.m. You should see what it's like when I don't take the medication.
Can you bring your hands down? Like this? Okay. That hurting you? Does that cause you pain?
Yes.
Is that causing pain?
Yes.
Peter? Okay.
Yes.
Okay.
That hurts when you do that.
Well, I don't want to upset you. We're not here to make this an unpleasant experience for you. We're trying to get some answers.
I try and stretch it. They've tried it. Everything I do, when I stretch it, the pain gets worse.
Well, for the purpose of
And then
of the record and the camera that's spinning here, we have to go on a little further with you because obviously the answer to making you resolving this problem is elusive, and we're going to have to chase after it a little bit.
well, if you're willing to write in your report, I'd like to see doctors like maybe specialists at hospital for special surgery, wherever they do, New York Presbyterian Hospital. That's what I'd like to do because I want to be able to drive a car, take care of myself, and work. And right now, that's not happening. The only thing that's happening is they're making me more comfortable with more pain medication, but
That's called masking.
yes, but without it, I'd be in the hospital because without the medication, I feel like you might as well throw gasoline on me and burn me.
Well,
Because that's what it feels like.
I have the similar problems, which I won't go into, but I understand what you're saying. Peter, it comes down to a very simple point. Right now, you've lost confidence in the care that you're receiving, and that if you get, let me finish now. I want this point of view to get across. And that sending you to a distant point, like New York or Cleveland or whatever it takes,
Sounds like a good idea.
You're not going to get well, Peter. You're not going to improve and mend, as the old saying goes, until you receive this consultation and evaluation. It's as simple as that.
Okay.
And without that, you're going to simply just continue with the same treading water that you're doing now. That's all there is to it. That's what we're going to have to arrange, and so your confidence has to be restored. And that's it. I'll do all I can to make that happen.
I truly believe that I just need to find the right doctor.
Yeah, that's
who
right.
Says
you're on a quest.
I've seen
Peter.
similar injuries, and I think I can help you.
Yeah.
And that's what I'm looking for.
Well, that may or may not be possible. There may not be anybody in practice that can do that for you, but at least we have to give it a try.
You're right.
And try to satisfy your needs and what's troubling you. And that's all I can tell you for today.
Okay.
Today's exam comes down to the same end point, and that is that you have to have confidence restored, and that's it.
What do you think a more recent MRI would be beneficial?
Well, it's another test. You've had tests.
The last ones.
But we have to. It's not for me to say at this point. This person that sees you, whether it's New York or whatever it is, I'm going to put in as my first suggestion the hospital of special surgery, and it's up to them.
Okay.
They may want to do that. They may want to
Okay.
do something else.
Let them make the decision.
That's right.
Okay.
Very good.
That sounds like logic to me.
Sounds like we're on the same page.
I'm willing to
So let's-
explore that.
Let's turn the off button on the camera and terminate this examination. I think we've covered all we can do for today, okay? You're all done. It's been a pleasure.
Okay.
Okay, buddy.